The United Nations and the World Health Organization set the 1990 goals as an ambitious target to bring HIV treatment to all who need it. Their aim is nothing less than to end the AIDS epidemic by 2030. To achieve this goal, at least 90% of the people infected with HIV should be aware of their diagnosis. 90% of all people diagnosed with HIV should be treated with HIV medication, and 90% of those receiving medication are treated successfully, illustrated by full viral suppression. Global figures from the end of 2020 showed that 84% of people living with HIV knew their HIV status, 73% were treated with HIV medication, and 66% had full viral suppression. However, these figures of the 1990 goals vary between the different continents. On a global scale, the 1990 goals are far from being achieved. Only a few countries have achieved them. An estimated 6.1 million people worldwide are unaware of their infection. In Europe, 1 in every 5 people living with HIV do not know their status, with Eastern Europe having more total HIV infections and undiagnosed HIV than Western Europe. 1,730 of those unaware live in the Netherlands. Adequate identification and testing of those unaware of their HIV status is the cornerstone to achieve the minimum target of the 1990 goals and is essential to stop AIDS. However, many opportunities to test for HIV are missed. A large majority of people with an undiagnosed HIV infection visit doctors with symptoms or illnesses known as HIV indicator conditions. Indicator conditions can signal an underlying HIV infection and should trigger testing. Despite being recommended by guidelines, many indicator conditions still remain untested for HIV. Continued unawareness of an underlying HIV infection has devastating consequences. A person with undiagnosed HIV can unwantedly transmit HIV in communities and suffer from significant health damage. Ultimately, undiagnosed HIV infections lead to many unnecessary deaths. That must be prevented. Timely diagnosis and successful treatment will prevent AIDS-related deaths. The life expectancy for someone treated for HIV approaches that of someone without HIV. Successful HIV treatment also means you can no longer transmit HIV to others, not to your sexual partners and not to your unborn baby. Therefore, U equals U, undetectable equals untransmittable. Aware HIV envisions to guarantee adequate testing for HIV in HIV indicator conditions, reaching all doctors and patients. As a group of passionate HIV expert healthcare professionals, HIV patients and community members, we provide education and start dialogues with doctors to raise awareness on HIV indicator conditions. Secondly, we proactively advise on HIV testing to non-HIV specialized healthcare professionals. And third, we reach out to the community to raise awareness and normalize HIV testing. You can also contribute. Visit our website to get information about common HIV indicator conditions like STDs, but also lesser-known diseases like certain types of eczema, shingles, or chronic unexplained diarrhea. Are you being treated for a HIV indicator condition, or do you think you have a HIV indicator condition? Asking for a HIV test can be difficult. On our website, you can download a quick reference card you can take with you on your next appointment with your doctor to help you ask this question. Aware HIV stands for HIV testing of everyone with a HIV indicator condition, regardless of origin, gender, age, or sexual preference. Let's break the stigma. Join and help, because together we can stop AIDS. For more information on HIV and AIDS, please visit our website, awarehiv.com. We are Aware HIV, a collaborative project initiated by the Erasmus University Medical Center.